Hello and welcome to our Spotlight session, engaging students with online wellbeing support, taking a look at our recently published Being Well, Living Well online toolkit, which provides consistent preventative mental health and wellbeing support that students can access anytime, anywhere, which now more than ever is so important. Over the past 15 years, Epigeum has developed a wide range of interactive online training courses to support the core activities of higher education institutions around the world, with universities in over 30 countries using Epigeum courses to advance the skills and knowledge of their academic and professional staff, researchers and students. All Epigeum courses draw on evidence-based learning design, as well as cutting-edge technology and comprehensive subject knowledge to deliver training of the highest quality across 4 key areas: research, teaching and development, support and wellbeing, and studying. As part of our support and wellbeing strand, we recently published the Being Well, Living Well online toolkit, which will equip students with practical strategies to maintain their mental health and wellbeing throughout university. So the toolkit will provide students with realistic strategies for managing their mental, physical, emotional and financial wellbeing. It'll also help students to build self-insight and understand that they're not alone in experiencing challenges in their personal and academic lives. Equip students with tips and tools for supporting others, as well as recognising the limitations of being a peer supporter. It'll also ensure students can identify when and where to seek further support if needed, and support existing wellbeing initiatives at your institution with online resources that can be accessed anytime, anywhere. So the toolkit's made up of 18 bite-sized modules. These are between about 20 to 30 minutes each, and they're split into 4 strands. So strand 1, Living Well. This strand covers the essential areas of wellbeing for successful study: your student journey, study life balance, studying well, postgraduate research, student wellbeing, eating well and being active. Strand 2, Feeling Well. This strand contains modules to support mental health, so including confidence, self-esteem and resilience, never good enough, stress, anxiety and depression, self-harm and suicidal thoughts. Strand 3, Staying Safe, includes online safety, healthy relationships, sexual health, alcohol and drugs. And finally, Strand 4, Spending Well, includes financial awareness, university costs and funding, and living costs. The majority of Epigeum programs are developed through a process of collaboration between world-class subject experts, partner institutions, and in-house specialists. And through this process, universities are able to create peer-reviewed content of the highest quality while sharing the cost, and thereby making consistent, cost-effective training available for all. Being Well, Living Well has been developed in collaboration with a panel of mental health experts, healthcare professionals, and university students and staff. The lead advisors, Dr. Dominique Thompson and Dr. Nicola Reevely, have led the direction of the project for both the UK and Australian versions of the toolkit, while Nightline Association has contributed as specialist advisor. This was a truly collaborative project, so we brought together a panel of subject experts and higher educational professionals to create and review content. Importantly, we also set up a student review panel, so that contains students from universities across the UK, primarily to ensure that the content is appropriate, authentic, accessible, and that the student voice really comes through clearly. And not least, our development group members from various universities in the UK and Australia came together at the initial project launch workshop last year, alongside authors, advisors, reviewers and Epigeum staff. So the 2-day workshop included presentations and roundtable discussions to ensure the planned modules would meet the needs of universities and their students. The development group therefore had significant input into the course planning and development, and provided detailed feedback during the Alpha review, as well as providing students to be included in the course videos. We had a really engaged group of student reviewers, and their feedback has been invaluable. So what do we learn from them? Firstly, it was important for the modules to be non-judgmental, positive, authentic, and to avoid stereotypes and unconscious bias. We also needed to choose terminology carefully and to be cautious of labelling. So it's a fine line between normalisation and trivialisation, and the tone needed to remain supportive throughout. Interestingly, although feedback from our subject matter experts and university staff warned against including too much scientific information, so for example, in the modules on alcohol and drugs, the students disagreed and wanted to know more, keen that we shouldn't underestimate their levels of understanding. And they also didn't want the language to be dumbed down too much. So the key is in making the messages accessible to all levels. And the benefit of having an online format, of course, is also that clickable glossary terms can be included in the text. This programme is designed to engage students in a difficult subject area by providing practical information and strategies, followed by activities that encourage students to reflect on their own experience and behaviours in order to identify ways to manage or improve their wellbeing going forward. Throughout the modules, there are real student voices and scenarios to help reiterate that students are not alone in facing these issues and to reinforce the idea that it's good to talk about their wellbeing. Other key features include signposting to further support, poll activities designed to compare attitudes and dispel myths, videos and animations, peer support pods and action plans. So I'm going to share a few screenshots of the material in the modules. So the modules themselves present practical information and self-care strategies, well as signposting to additional resources and support in useful links pods and resource banks that direct students to university services or national organisations as appropriate. Context pods also offer the potential for customisation for universities that will be using the programme through their VLE, so they can include their own specific links and guidance. And peer support pods throughout also provide tips for supporting others while recognising your own limitations as a peer supporter. Videos of students sharing their experiences and their own practical tips are integrated throughout, as well as high quality animations to explore key concepts and themes. Modules also incorporate real student voices and scenarios, normalisation experience, and represent the diverse student population. And finally, there are plenty of opportunities for students to reflect on the advice and to consider how it could apply to them. Plus, action plans at the end of each module allow students to build a list of personalised steps to help maintain and improve their academic or personal well-being. Our team is now working closely with universities to help them implement the toolkit, and I'll share with you a few of the common approaches. Firstly, as wellbeing is such a high priority for universities right now, there's a real desire to make the toolkit available to users as soon as possible, even if the university do plan to make some changes that they might roll out later. And many are planning to include at least some of the modules as part of their pre-arrival induction programme. Most institutions plan to customise the programme in some way. One of the most popular types of customisation, for example, is adding a video by a senior member of staff. So a specific example is a PVC for student experience who will be filming an introduction to the programme, which will be added on a new screen at the beginning of the course before the programme is uploaded to their VLE. Universities can also add links to their own resources directly into the modules and can use and adapt the additional activities that are included in our instructor's manual as part of a blended approach. All our development group members have recognised the importance of project champions in helping to spread the word, and some have targeted residential life staff, directors of education and student experience, and wellbeing advisors. Some institutions intend to use those initial discussions with wellbeing advisors as a point to recommend modules according to specific needs. However, project champions may also include particular student groups tasked to help recommend the toolkit to their peers. So finally, for those of you creating your own resources, here are top tips for creating an engaging online course. Number 1, collaboration. So involve your stakeholders in all stages of the process, from concept planning to content review and implementation. 2, learning design. So make the content accessible and interactive with opportunities for students to personalise the learning. And 3, implementation. Consider what the message is that you want to deliver and how best you can reach your student groups. So think really creatively. How will the course fit alongside other resources? And can it be part of a blended learning approach? So that's it from me. Thank you so much for watching. We hope that you found it to be an insightful introduction to the Being Well, Living Well toolkit. Please do follow Epigeum on Twitter and LinkedIn and visit our website to find out more about our programmes.